focusing on you. From your team of experts at Sylvester Comprehensive Cancer Center, South Florida's only National Cancer Institute designated cancer center.
David Lampl is a scuba diver by trade and faced sharks, but never imagined facing colon cancer at 42.
I had zero symptoms. You would never known anything was wrong or different.
David's mom also had colon cancer. UHealth gastroenterologist Dr. Sunil Amin says an early screening colonoscopy is critical for those considered at high risk.
For example, those with a family history of colon cancer. Those people should be screened at 40 or 10 years before the earliest diagnosis of their family members. By coming to UHealth Durrell, you really have access to the army of specialists we have at the University of Miami, and that's kind of the point, to bring this academic level care to the community here.
Because David's a scuba diver, Dr. Amin wanted to avoid surgery, which would have left him with a colostomy bag. By performing the ESD procedure, David was able to recover quickly and get back into the water doing what he loves.
ESD is endoscopic submucosal dissection, and it's a highly specialized, minimally invasive endoscopic procedure where we are able to remove an early cancer or an advanced colon polyp from the lining of the colon in one piece and send that to pathology. And most importantly, usually these types of polyps or early cancers would need to be sent to surgery. And so this procedure hopefully allows us to save a lot of patients the morbidity of a large surgery.
ESD can be performed at the time of colonoscopy or as a separate procedure. David had ESD in 2021.
Very blessed. I know it could have gone a lot differently.
David is back diving and encourages everyone to get screened.
Definitely just go, I guess, because you never know. I would have never gone if it weren't for my mom pushing me. And if I hadn't gone, I wouldn't be here right now.